Okay, so this is a 68-year-old female. 3 days ago, she kind of did a split, stretched out the right hamstring, and she can see she has some ecchymosis and tenderness, mainly at the ischial tuberosity and somewhat distal to that. She got some ecchymosis in the proximal medial musculature. We're just going to go ahead and just do an ultrasound to really look at the tendon attachment on the ischial tuberosity.
Here we're looking at the ischial tuberosity in a sagittal plane. You can appreciate essentially this bogginess of tissue around the ischial tuberosity. You could see some fibers of the semimembranosus tendon and conjoint tendon, somewhat distal to the ischial tuberosity, but really hard to see any attachment of fibers. Here again, you see just anechoic and hypoechoic signal around the ischial tuberosity consistent with tearing. Here you see a pretty large anechoic area consistent with a hematoma secondary to this muscle tear. Here we're going a little bit lateral, and it actually looks like there are some continuous fibers going towards the ischial tuberosity, but the question is whether these fibers are still continuous with the muscle distally, and it seems like this is essentially just about a complete avulsion of both the conjoint tendon and semimembranosus tendons. Here we're going a little bit distally again. You can see this large fluid collection consistent with this hematoma, and occasionally you can try to drain these hematomas, but once they start organizing, you're really not going to get much fluid out. Now we're going to switch orientation to an axial view of this injury. Right side of the screen is going to be lateral. Here we're looking at the ischial tuberosity again, and again it looks like there are some continuous fibers of the semimembranosus and conjoint tendons just above the ischial tuberosity. Again, we're going distally. We can appreciate this hematoma now in a axial plane. Somewhat mixed heterogeneity with some hypoechoic and some anechoic signal within this very large fluid collection. And now we're going up proximally again towards the ischial tuberosity. You can see the extent of this hematoma as it covers quite a fair amount of territory. And here we're going proximally again towards the ischial tuberosity. And there may be some tendon fibers attaching to the ischial tuberosity, but unlikely are these fibers continuous with the muscle distally.